Hello and welcome back to Unacademy. So let's crack NEET PG. Myself, Dr.Muskan Chaudhary, and we will be dealing with the images from the parasitology. Let's continue with the parasitology. I'm your mentor on the NEET PG Unacademy for the microbiology subject. And on Unacademy, you can access both the live and the recorded sessions. And soon you are able to watch both the recorded sessions and the live whenever and wherever you feel like, specifically for those students beneficial for them who are the periphery and are not able to manage the time accordingly and compete in the live T&Ds. S2 preparation with the highly competitive exams that are being conducted by the Unacademy, and study on your device and mark up to 25,000 of the MCQs. Now, 50 to 100 MCQs we aim at doing 50 to 100 MCQs per day, and Unacademy has a bunch of around 25,000 of MCQs. Printed notes and digital notes are being provided by the Unacademy. PrepLadder has come together with the Unacademy, where short revision sessions and the rapid revision sessions are very famous for the PrepLadder, and to complete the all 19 subjects within short period of span. The PrepLadder is one of the institute of the best of its own, and the Unacademy has collaborated with it. You will get well structured live batches, recorded classes, QBanks, competitive T&Ds, comprehensive digital notes, clinical integrated essentials, the video lectures, QBank, rapid revision, and the treasures and the 2021 dream notes. In NEET PG, for 24 months, it's around 15,000, 1,500 per month. It will cost you around just 1,500 per month. And for Iconic, it will cost you around 2,438 per month. Please do use my code, that is Muskan10, to get 10% of the discount. All right, now raise a hand. Raise a hand feature is something that is unique to the Unacademy and specifically present on the Unacademy, where you can personalize your interactive class and educators can drive engagement with the quizzes and the Viva and one-on-one interaction with your favorite educator. Exam day is was on the 23rd of the October from 2 to 4 p.m. and around 120 MCQs were covered. 120 MCQs were covered. All right, 25,000 MCQs are being given by the Unacademy based on the latest examination patterns, and which includes the detailed explanation. Interactive highly classes, you can do the polling for the learners, raise a hand features, and talk to a favorite educator in the live class and get your doubts resolved. And never miss a class on the Unacademy because you do get the notification. Attend have the digital printed notes and attend your classes anywhere and everywhere and get your doubts clear, although all those in the live class. And if you're not able to attend the live class, just have the recorded session. For 20 months, 4 months subscription, 4 months subscription is totally free, and with 12 months subscriptions, 2 months subscription is what? Totally free. All right, we did, yes, in the last session of the parasitology images, we already covered about the this Entababy histolytica and Giardia lamblia and Trichomonas vaginis. All right. Okay, now we'll cover the next image. Please identify the image. Please identify the image. Okay, please identify the image. Okay. Mm, this and this are exactly same. This and this are the exactly same. And this is what? Infective form, that is for which disease we are talking about. For which disease we are talking about? We are talking about Leishmaniasis. Okay. We are talking about what? We are talking about Leishmaniasis. We are talking about the Leishmaniasis. All right. Now, this is LD body. This is LD body. This is Leishmania body. This is Leishmania body. And what is the habitat? What is the habitat for the Leishmaniasis? It is what? It is reticuloendothelial cell. Reticuloendothelial cell. That is the immune cells are the habitat. Immune cells are the habitat for the Leishmaniasis, and they have the special DNA that is called as what? Kinetoplast. That is called as what? Kinetoplast. Okay. So this is the amastigate form in the LD bodies, because amastigate form is what taken up by the macrophage, and they are present inside the macrophage in the form of the LD bodies. In the form of the LD bodies. All right. Now this is will come next to the host. The host is what? Man is what? The host. Man is what? The host. So this is the LT body, this is the amastigate form, this is the promastigate form, and this is again the LD bodies. Now, this is the amastigate form. Host is what for the leishmaniasis? Man is the host. Man is the host, and what? Vector? Vector is what? Sandfly. Vector is what? Sandfly. And what are the reservoirs? What are the reservoir? The reservoir are the mammals and rodents. Okay, even dogs are also the reservoir. What is the infective form? Infective form is what? Promastigate form. Promastigate form that is present in where? In the sandfly. In the sandfly. And what is the diagnostic form? What is the diagnostic form? It is the आदमी में A for A, that is A mastigate form. That is A mastigate form that is present inside the macrophage. That is what? LD bodies. It is what? LD bodies. That is what? LD bodies. So what is the infective form is what? Promastigate form from the sandfly, and diagnostic form is what? Amastigate form, that is A say A, that is present where? In the admi. Alright, now when we talk about the disease, that one, it causes what? Visceral leishmaniasis. Visceral leishmaniasis, that is also known as the Kala Azar. Kala Azar. Alright, and it is caused by Donovani complex, that is Leishmania donovani, Leishmania infantum, okay, and Leishmania chagas. Alright, so Leishmania donovani and Leishmania infantum. Alright, so this is the amastigate form or the Leishmania donovani, and this is the amastigate form that occurs in A4A, that is Admi. Now, now, vector is what? The sandfly, that is the phlebotomist that we talked about in India. In India, no extra human reservoir is present. In India, no extra human reservoir is present. In India, there is no extra human reservoir, and the incubation period is around 3 to 6 months. Incubation period is around 3 to 6 months, and in India, no extra human reservoir is there. Now, what are the symptoms? What are the disease that symptoms that the patient will present with? Patient will present with the fever. He will present with malaise. He will present what? Hepatosplenomegaly. He will present with hepatosplenomegaly. And we need to remember very important, pancytopenia. Pancytopenia and hypergammaglobulinemia and hypergammaglobulinemia. Okay, so we present with what? Pancytopenia, hypergammaglobulinemia, and what is the most common cause of the death in the leishmania? It's what? Secondary bacterial infection. Secondary bacterial infection. In India, there is no extra human reservoir, and patient will present with pancytopenia with hypergammaglobulinemia. And what is the most common cause of the death is what? Secondary bacterial infection. Secondary bacterial infection. For the diagnosis, one is that patient will present with what? Pancytopenia, hypergammaglobulinemia. Therefore, AG ratio will reverse. AG ratio will reverse. Second is that we do the tissue biopsy. Okay, we do the tissue biopsy, and what is the most sensitive? It is what sensitive is what? Splenic aspirate is the again important question is what? Splenic aspirate more than bone marrow. Again important question, that tissue biopsy will take the splenic aspirate more than the bone marrow, then liver, then lymph node, and last is what? The buffy coat. Least sensitive is what? The buffy coat. Least sensitive is the buffy coat. Please remember कि tissue aspirate tissue aspirate splenic as tissue biopsy splenic aspirate is most sensitive, then it is bone marrow, and least is what? Buffy coat. Buffy coat. Least is what? Buffy coat. How do we create the buffy coat? Either by the culture in the N media, that is a Novi, McNeil, and the Nicole media, or in the experimental animals. And we also do the PCR technique, and we can also use the PCR techniques. And for the serology, use we use non-specific methods. We use non-specific methods like Napier's aldehyde test, and Chopra's antimony test. ठीक है, Chopra's antimony test. ठीक है, and we check out for the hyper gamma globulinemia. ठीक है, for the serology we either use a non-specific test like Napier's aldehyde and Chopra's antimony test, but hyper gamma globulinemia can also occur in other infections as well, and can also occur in malignancy as well, and other autoimmune disease like multiple myeloma. So hypergammaglobulinemia is not a characteristic of it, because it can also occur in other infections, malignancy, and this multiple myeloma like autoimmune diseases. So non-specific test we check for the hypergammaglobulinemia by the Napier's aldehyde and the Chopra's antimony test. For the specific serology, either we do direct agglutination test, or we do indirect agglutination test, or either we do ELISA. Okay, and what else we can do? We can do Leishmania skin test, which is also known as Montenegro test, which is type of what? Delayed type of hypersensitivity test, which is delayed type of hypersensitivity test, that we are talking about Leishmania skin test, or Montenegro test, that is a type of delayed type of hypersensitivity test, and it becomes positive after 5 to 7 weeks of infection. It becomes positive after 5 to 7 weeks of infection. If it is negative, then it is negative either in the active Kala-Azar, or it is negative in the diffuse cutaneous leishmaniasis, or or progressive leishmaniasis, or progressive leishmaniasis. Okay, so it is negative either in the active disease or progressive disease or the diffuse leishmaniasis, and it is positive in what? Successful treatment or asymptomatic treatment, or self-resolved cases. Self-resolved. Okay, so it positive where? It is positive either in the successful treatment or self-resolved treatment, or asymptomatic cases. Okay, for the treatment, what to do for the treatment in India? What is the treatment that we give in India is what? Sodium antimonial compounds we give, that is stebo, sodium stebogluconate. We give out sodium stebogluconate, but in Bihar, there is more than 60% strains are resistant. More than 60% strains are resistant. Therefore, we cannot give the sodium stebogluconate. What we give? We get what lipid-coated amphotericin B. Amphotericin B. And even in the West, what is the drug of choice? It is amphotericin B. Important question. In Bihar, it is amphotericin B, and for the rest of the world, also it is amphotericin B. But in India, it is sodium stevogluconate. The sodium stevogluconate. Now we'll come to the another type of the leishmaniasis. That is what? That is the cutaneous leishmaniasis. Cutaneous leishmaniasis. Okay? And what we need to remember in the cutaneous leishmaniasis, what are the other name of the cutaneous leishmaniasis? It is what? Oriental sore, or Delhi boil, or Lucknow boil, or Baghdad boil. What are the other names for the cutaneous leishmaniasis? That is the Oriental sore, Delhi boil, Lucknow boil, or Baghdad boil, Okay, and it is caused by what? It is caused by the Leishmania tropica and Leishmania major and Leishmania Ethiopia. Leishmania Ethiopia. Okay? Leishmania tropica major and Leishmania Ethiopia, and the patient will present with pizza base like ulcers. Pizza base like ulcer. Okay? Pizza base like ulcer, but in most of cases they resolve spontaneously. They resolve spontaneously. Okay? So cutaneous leishmaniasis, what are the other name for the cutaneous leishmaniasis? Oriental sore, Delhi boil, Lucknow boil, Baghdad boil, and leishmania tropica and Ethiopian major, and pizza base like ulcer, and that will resolve spontaneously. That will resolve spontaneously. What was the other type of the leishmaniasis? It was what? Mucocutaneous leishmaniasis. That 90% cases are from the Peru or the Brazil, and vector is the same, that is a sandfly, and the patient will present with polyploidal mass in the oral and the nasal mucosa. Okay, that is mucocutaneous leishmaniasis. Mucocutaneous leishmaniasis. This is the sandfly phlebotomus. That is a vector for the leishmaniasis. How did we remember? You can see his small hairy like structures, small hairy on the wings of the on the wings and the body surface of the sandfly. So you can help this can help you to remember that you can see these hair like apertures on the wings as well as on the body surfaces. Now, promastigate form is what present in the rosette form in the culture of the and media. So please remember this, that promastigate form is present in the rosette form. In the rosette form. Okay, where in the and media, that is Novi McNeil and the Nicole media. Montenegro Leishmania test is what delayed type of hypersensitivity, where it is positive and the negative we have seen. Alright, for the cutaneous leishmaniasis ulcer with the sharp indurated margins, and what is the name? This is a pizza base like ulcers. And culture, we detect the promastigate form. Montego test is positive more than 90% of the cases. Visceral leishmaniasis patient will present with hepatosplenomegaly, and very important is what? Pancytopenia. Pancytopenia and the hypergammaglobulinemia, and we detect the amastigate form in the microscopy, and the splenic aspirate bone marrow, and the least sensitive is what? The Buffy coat is what? The Buffy coat. Alright, for the culture, we detect what? Culture. In the culture, we see what? The promastigate form, and animal inoculation to see for what? The Montego test. Now, visceral leishman is Kala Azar or the dum-dum fever. Kala Azar is also known as the dum-dum fever. Is also known as the dum-dum fever. Okay. Now, Kalaza was also called as a dum-dum fever after a military station in the outskirts of the Calcutta showed the symptom of the low degree of the fever with the hepatosplenomegaly and the wasting of the muscles, cachexia, swollen lymph nodes, leukopenia, thrombocytopenia. The parasites are mainly found where in the bone marrow, liver, and the spleen. Now, indirect laboratory test, one method we do is what the Leishmania Montegro test, and this is the infective form for which of the or pathogens for which of the protozoa we are talking about. We are talking about what? Okay, this is metacyclic metacyclic trypnomastigate form. Trypnomastigate form, that is the infective form for what? Infective form for trypanosoma. Okay, that is Trypanosoma brucei and the Trypanosoma cruzi. That is the infective form for the Trypanosoma brucei and the Trypanosoma cruzi. And this is what? This is the kinetoplast. This is the kinetoplast. So first we'll talk about the Trypanosoma cruzi. First we'll talk about the Trypanosoma cruzi. C4C, that it causes what? Chagas disease. It causes what? Chagas disease. Chagas disease, or it is also known as South American, South American disease. ठीक है, it is also known as South American trypanosomiasis. Trypanosomiasis. ठीक है, so we are talking about the Chagas C4C that is caused by the Trypanosoma cruzi, and it is what? South American trypanosomiasis. South American trypanosomiasis. Man is the direct host. Man is the direct host, and what is the vector? What is the vector? Vector is what? Radiovic bug. Radiovic bug, or the kissing bug, or the kissing bug. Okay? And it is the biological true vector, radiovic bug, or the kissing bug, or the kissing bug. Okay? And what are the reservoir? Reservoir are the mammals. And what is the infective form? Infective form is the same, that is what? Metacyclic trypnomastigate form. Okay? Chagas C4C cruzi, and what is the vector? That is the radiovic bug, because in when we'll talk about the symptoms, we'll see what the Ramona sign on around the eyes and the cheek. So you can remember that radiovic bug kissed on the cheeks. Okay, that is cheeks, we get Ramona sign. Radiovic bug is the vector, and C for Chagas, that is the Trypanosoma cruzi. Now this is the radiovic bug. Radiovic bug, that is what? That is the kissing bug. Okay, kissing bug. It will kiss where? On the cheeks, and the patient will present with periorbital edema. And what is the name of the sign? That is what? Ramona's sign. Ramona's sign. That is the Ramona's sign. Incubation period of around 7 to 10 days. 7 to 10 days. Remember, that is a periorbital edema. Patient will present with periorbital edema, and that is what? Ramona's sign. That is what? Ramona's sign. In the GIT, the patient present with mega esophagus and megacolon, and in the heart is what? Dilated cardiomyopathy. Dilated cardiomyopathy. ठीक है, so it is causing what? Periorbital edema, Ramona sign. This is what? Nothing but this subcutaneous nodules, also known as chagoma. Okay, so how do we remember it? That Trypanosoma cruzi C4C is what causing what? Chagas disease, and it is by kissing on the cheeks, that is kissing on the cheeks by radioic bug, and it is kissing on the cheeks and signs symptoms present around the eyes, that is causing what periorbital edema. Ramona's sign, it is what subcutaneous nodules, and in the heart the patient present with dilated cardiomyopathy. All right. Now, what for the diagnosis? What do? We do the Buffy coat. In the Buffy coat, we look out for the infective form, that is trypanosoma, metacyclic trypanosoma. All right. And now, what is the treatment that we give? What is the treatment? Is what nephrotomox or benzimidazole. Nephrotomox or benzimidazole. Okay, nephrotomox or benzimidazole. That is, we are talking about the Chagas. This is the periorbital edema. Periorbital edema. Periorbital edema or chagoma or Ramona's sign. Okay. Ramona's sign, periorbital edema, chagoma, or the Ramona's sign, that is found where in the acute Chagas disease, which consists of the painless edema, which consists of, it is a painless condition of the palpebral and periocular tissues. Okay, it is what, it is a painless condition, in the heart the patient will present with dilated cardiomyopathy, and nifurtimox and the benzimidazole are the drug of the choice. Now, this is what we are talking about. We have talked about Trypanosoma cruzi, and this is what, this is the CC fly, and this is a vector for Trypanosoma. This is the vector for the Trypanosoma brucei. Is the vector for the Trypanosoma brucei, and CC fly is causing what? Sleeping sickness. Causing what? Sleeping sickness. Is causing what? Sleeping sickness. All right. Okay. So this is the CC fly, and this is a vector for the Trypanosoma brucei, and CC fly is causing what? Sleeping sickness, and it causes two types of Trypanosoma brucei sleeping sickness. That is, one is the West African, and another is what? East African. Okay, तो दो तरह के हैं. One is the West African and the East African. West African is caused by the Trypanosoma gambians, and it is caused by Trypanosoma rhodiensis. Okay, so definitive host is again, definitive host is what? Man. Vector is what? Vector is what? CC fly. Okay, it is Glossima species, and reservoir are the mammals, and the infective form are again metacyclic trypnomasticate form, and by the bite of the CC fly, the disease is what? Transmitted. All right. So disease, the what is the disease that is mainly caused in the Trypanosoma brucei? Trypanosoma brucei, it is what? It will cause what? Hemolymphatic. It will, patient will present with what? Hemolymphatic stage. Hemolymphatic stage. Patient will present with the hemolymphatic stage, and winter bottom sign. Winter bottom sign. What is it? We'll see that winter bottom sign. Patient will present with the neurological symptoms as well. That is what? Alteration in the sleep rhythm. Alteration in the sleep rhythm. Okay? Alteration in the sleep rhythm. Now, what we do for the treatment? What we do for the treatment for the hemolymphatic stage? For the hemolymphatic stage, what do we give? We give what? Suramine and the pentamidine. Suramine and the pentamidine. Suramine is mainly for the treatment of the East African, sleeping sickness, and this is for the West African sleeping sickness. Okay, we give what? Suramine and the pentamidine, and suramine is mainly for the East African. How do we remember? This is how we write S, and this is how we write E. Okay, and pentamidine is mainly for the West African sleeping sickness. For the West African sleeping sickness. In the neurological phase, what we give the treatment? We give what? Eflornithine. We give what? Eflornithine as the drug. We give what? Eflornithine as the drug. Now, this is the Winterbottom sign. This is the Winterbottom sign, that is the enlargement in the hemolymphatic stage, enlargement of lymph nodes in the cervical triangle, Okay, that is what Winterbottom sign, that is one of the cardinal sign of the African sleeping sickness, So what are these? You can see clearly what are these? So this is what? Neurocysticercosis. Neurocysticercosis. Okay, that is found in the brain. That is the cyst form of the tinea that is found in the brain. Is what? Neurocysticercosis. Okay. Life cycle we are not going to discuss right now. Now this is what you can see. This is what? This is high dated cyst. This is the high dated cyst. Okay, high dated cyst where it is found? That is found in Echinococcus granulosus. Okay, it is found where? In the Echinococcus granulosus. It is the high dated cyst in the liver. Now we need to this again question, and it has been asked repeatedly in the AIMS examination. The layers. This is what we know. We need to know about the layers of the high dated cyst. Need to know the layers of the high dated cyst. What is this? What are these layers? What are these layers? Now, this is the germinal epithelium. This is the germinal epithelium. This is what the brood capsule consisting of what? The protoscoliosis, and this is the high dated cyst wall. This is the cyst wall. This is the cyst wall, and this is the germinal epithelium consisting of inside the protoscoliosis and the brood capsule. Okay, so this was it about today's session. It was a short and sweet session about the images. So I'll see you again in the next session, and till then, take care and bye bye. Be safe at home, study well for examination, and give your best, and prepare well. Okay, and have good sleep and good mental health. Okay, all right, so take care and bye bye.